In Port Charlotte, there's a thoroughfare called Easy Street. But the folks who file through the doors of the modest modular building at the corner of Easy and Gibraltar don't live on Easy Street, not by a long shot. Life is far from easy for the unemployed, the working poor, the homeless, the disabled, and the needy who comprise the patient population at the St. Vincent DePaul Community Health Clinic.
Most of the people around this county don't live on Easy Street. There is an Easy Street, by the way, but I mean, allegorically, there's no Easy Street around here. Most of the kids in the school district live below the federal poverty guidelines, and this is becoming more and more of a problem as more and more people have no insurance.
It's very sad. When people walk through the door, they see uncertainty, and for them to come here to a free place to begin with, they have to be pretty down and out. And it's like, oh my gosh, I don't really want to be here because I don't know what to expect. I don't know how to handle this. They come in here, and the first thing that we make sure that they do is they are greeted with a smiley face, because we truly care about our people. We care about everything that happens to them, and we want them to know that we're here to help them, we're here to service them, we're here to take care of them.
The clinic, which opened in early 2008, is a spin-off from the St. Vincent de Paul Community Pharmacy.
It was primarily set up as a community pharmacy to assist elderly who couldn't afford prescription medicine. Over the course of 8 years, we've dispensed $5 million in free medication to those in need. The way we were able to accomplish this is that the bulk of the medicine we were dispensing were donated samples given to physicians that we then dispensed to other individuals.
Port Charlotte ophthalmologist David Klein is board president and co-medical director of the clinic.
That started with a dream, a couple of physicians and a couple of people in the community. We had the St. Vincent de Paul Pharmacy for many years, and at a board retreat several months ago, actually last year, one of our local good guys, Dr. Asprilla, the director of the pharmacy, said, let's go to the next step. Let's try and do a clinic for the medically indigent who just have nowhere to go.
With as many as 40,000 Charlotte County residents uninsured or underinsured, the clinic's physician founders felt compelled to act rather than wait for health care reform at the national level. Without action, they felt, people could die for lack of care.
Unfortunately, that can be sometimes the only alternative if they don't have the insurance that's necessary for complicated care. A lot of times, someone will say, well, if I had insurance or I had the money, I could have a liver transplant. But that still requires a lifetime of care afterwards with anti-rejection drugs and constant monitoring. And you're right, if you don't have the money and don't have the insurance, then you surely will die. And I don't find that acceptable in our society. I just don't, and I never have.
The St. Vincent de Paul Pharmacy and Clinic reflect a new spirit of grassroots activism that is popping up across the nation. For what makes it special is that it is staffed and operated almost exclusively by volunteers. They include Dr. Alan Gruning, who is merging the free clinics he founded a decade ago with St. Vincent de Paul Healthcare.
Everything is built around volunteers, the doctors, the nurse practitioners, the physician's assistants that are going to be working with us, except for the occasional paid person. Most of this is going to be volunteers, the nurses, the clinic workers, the intake personnel, the prayer counselors. Everybody that works in our clinics are all volunteers, and that's a critical aspect of this, because not only does it keep the cost down, but it gives those people a sense of fulfillment that they're actually doing something to help contribute to the community and are making a difference in people's lives, and it's extremely gratifying.
One of the reasons that we were able to get our clinic up and running so quickly is the program called Volunteers in Medicine, and it was started back several years ago by retired doctors. And what they're all looking for is the ability to be able to help people without the pressures of the everyday practice. And we are one of 58 clinics here in the United States that are called Volunteers in Medicine, or the VIM clinics.
The creation of the St. Vincent de Paul Clinic was the result of a team effort involving local government, the medical profession, and the local hospitals.
The role of the county helping the clinic get started is actually financial. We supplied the money necessary to open up, a good portion of the money, to open up the clinic for the people who are in need. And with the help of Dr. Klein and all the other physicians in the county who are volunteering their times, and the nurses and things this fashion, made it very, very obvious that we needed to do something for the people in this community.
The hospitals have been working a long time to try to come up with a program like this. We weren't really getting a whole lot of assistance from the state level or from the federal government. We were really pleased to see some key physicians in the community step forward and were willing to put their time and effort behind getting this clinic started.
In a field shrouded with doubt, controversy, and uncertainty, there are those who believe the answers to the nation's healthcare crisis may lie in volunteer community involvement.
I think you will see more clinics like this in the future unless there is action from a higher elected authority. I just don't see that happening anytime soon. The staff members who get involved with these clinics do enjoy it. It is a true labor of love getting involved back to what they trained when they first went to medical school.
Clinics like this do more than just meet the medical needs of their patients. They also serve as portals to the complex and sometimes bewildering healthcare bureaucracy.
As a patient advocate, we really do serve the public. We serve the people. I have about 30 patient advocates that come from all walks of life. It's amazing. Some of them are retired nurses, some of them are just people that want to get out and do something. Some of them are even working people who want to try and give us a little bit of their time. They like working with people, they like helping other people. When we see people, we feel it from the heart.
Robert Coogan is a 17-year Port Charlotte resident who lost his job and his health insurance.
Right now I'm unemployed, but I was in the technical field for a long time, working with computers and stuff like that.
It was Coogan's first visit to the clinic, and he wasn't aware it was staffed by volunteers.
If they're donating their time to the public, that's a wonderful thing too.
You're being referred to a volunteer health provider.
Not long after the clinic opened, there were signs it was already making a difference in the community.
That evening that I was there, Dr. Klein came in and he said, "My gosh, we had 3 acute cases of pneumonia this evening that had we not addressed the situation, it would have become critical, and these folks probably would have died as a result." So we know right out of the gate we were saving lives.
So for the medically needy and the uninsured of Charlotte County, it might not quite be easy street. But thanks to the volunteer staff at the St. Vincent DePaul Health Clinic, it's a lot easier.